Hello, my name is Dr. Bruno Lemay from Desert Dental Alternatives, and today I'm presenting you something totally different than what I have presented to you in the past. I'm known for thinking out of the box, and you have seen that with my episode on mini dental implant technique, stem cells bone grafting, and offering CT scan in my office. Now this year, I've decided to present you with a couple of cases of extreme mouth rehabilitation to show you that sometimes with a dentist who is not afraid to think out of the box and has the experience to do it, you can get different alternative treatments for much better result at a lower cost. You may have seen the first episode with Jill and Leo where we were able to fix their dental problems and avoid braces for them. Well, today we are going to talk about something totally different. Major cases, but different than Jill and Leo's cases. My first one is the case of Brett, a young man from San Diego who suffered a major blow to his face, destroying part of his upper and lower jaw and one eye. You will see how I was able to use my 26 years of experience and expertise in surgical technique as well as prosthetic technique to give him back the smile and function he needed to enjoy life again. My second case is a case of malpractice where my patient, Mrs. Faye McKay, put all her trust in a dentist only to end up $70,000 later with a total failure of her rehabilitation by implants and not knowing where to go from there. Please stay tuned to see the amazing dental transformation for Brett and Faye.
You're watching Desert Dental Alternatives Case Files with Dr. Bruno Lemay. Dr. Lemay practices state-of-the-art technology with artistry and compassion to achieve life-changing results. Join Dr. Lemay and actual clients as each step of treatment is explained with amazing before and after photos. Here's your host and renowned dentist, Dr. Bruno Lemay.
My first case is the case of Brett from San Diego, a very good-looking young man. He likes to fix cars, and one day when he was working on his car, something blew up in his face and took one of his eye and part of his upper and lower jaw. The oral surgeon did an amazing job to save his life and put everything back together the best he could. But unfortunately, it left him with a huge gap in his mouth, with 5 missing teeth on his lower jaw and 4 on his upper jaw, with severe bone loss.
I was home welding on a vintage trailer from the 40s to go with a car that I was restoring. I had welded on a small 8-inch wheel for the trailer, and it had exploded because there was a tire sealant within the tire and rim. Either the tire or the rim that I was working on hit me in the face. It took my welding helmet and split it in half, and I had goggles underneath as well. It cut into my face, basically filleted it in half, through my nose, broke my whole palate, broke my jaw, and knocked out 9 of my teeth. I woke up a week later in the hospital. I spent 6 weeks in the hospital, recovering on a ventilator with a feeding tube. Had my eye removed at a later time.
This was 6 years ago. Over the years, Brett saw several other dentists who attempted to restore his mouth. He had some bone grafting done in his upper jaw, 3 implants placed on his lower jaw, and 1 on his upper left premolar. The bone graft and upper implant were a success to a certain limit, but the lower implant were a total failure as they were placed at a wrong angle, making it almost impossible to restore prosthetically. So after that, Brett saw several dentists to restore those implants, but nobody wanted to take care of that because of the fact that the lower implants were not restorable the way they were placed. This is often what happens when a dentist or a specialist placing the implant is not the same fabricating the prosthetic afterward. It's rare to find a dentist who can do both the surgical and the prosthetic phase.
I learned about Dr. Lemay through a friend, and he had recommended him because he had looked at some pictures of mine from my accident and had seen all of the troubles that I was going through.
After hearing his story and seeing that he was desperate to have someone willing to help, he referred Brett to me because he knew my expertise with implants at the surgical level and prosthetic level, and that I would be willing to take that challenge.
It made it a lot easier for me in the way that I'm not completely confused as to who should be doing what and when's happening where. All of it's laid out for me, and Dr. LeMay can do everything for me in his office, which for me is a huge relief.
When I saw Brett for the first time, he had 2 floppy removable acrylic partial dentures for 3 years. And I could see through the skin the malposition of his lower implant positioned on the labial aspect of the ridge. So the first thing I did before promising anything to Brett was to do a comprehensive examination with X-rays, 3-dimension CT scan, intra and extraoral pictures, and mold of his actual teeth.
The first time I went to Dr. LeMay's office, he had a very friendly staff. They were able to do imaging in-house. He sat me down and did an exam, did models, and then discussed with me every step of his plan for reconstructing my mouth, and gave me timelines with everything.
After completion of the examination and treatment plan, the mold were sent to the lab to request a wax-up for the future prosthesis. This way, the patient can really see what I'm planning for him and what it will look like when it will be done. So my treatment plan with Brett was as follows. Removal and reposition of the lower malposition implants with 5 months healing. Removal of the bone graft screw on the upper jaw and placement of 3 new implants with new bone grafting with 5 months healing. Skin graft over the upper and lower sides. Making better temporaries for the healing period. Making a fixed upper and lower acrylic implant restoration. Fabrication of final porcelain restoration for the upper single premolar and upper anterior fixed prosthetic, as well as the lower fixed prosthetic. And finally, whitening tray for the rest of his natural teeth, with an anticipated treatment time of 12 months. So as you can guess, Brett accepted and was thrilled that after 6 years, he could finally see the light at the end of the tunnel. And we started in May 2016 with the removal of his lower implants and the replacement with better angled implants. Then a couple of weeks later, I placed the 3 upper implants with new bone grafting and removed the previous surgical screws. Then we had to wait for 4 months before being able to use those implants to anchor a fixed acrylic temporary. At that stage, Brett started to get really excited because the surgery was over and the fixed restoration, even though they were just acrylic, were giving him the sensation of having natural teeth again and was helping him to eat and speak better also.
To be able to eat apples or mangoes again, a burrito, to be able to walk into a job interview and feel like $1 million will be a big thing for me. But I guess the biggest thing for me is that everyone takes for granted what I have to deal with on an everyday basis is just being a normal person.
That's what he had been waiting for 6 years. At that time, it was just before Christmas, and we were ready to install the final lower fixed bridge. What a nice Christmas gift it was for Brett.
On the next episode of Case Files with Dr. Bruno LeMay.
The smile for me is an expression of my soul and my joy that I feel.
Jill is a very active woman, a former bodybuilder. In her early 60s, she even made the cover of Life magazine last year. Because she never got a treatment plan that was working for her, she let her teeth go. And I'm happy that I'm able to bring her an alternative treatment that will make her confident and at ease about making a decision to do something.
He treated me as an informed individual, not as a doctor looking down at me. His equipment is so high-tech. His bedside manner is amazing. He is a very gentle person, and I really highly, highly recommend him.
And now, back to our program.
Okay, so today it's been about 8 months since we start, and it's very exciting today because we're at the point of finishing the upper jaw. The lower jaw was done, 2-3 weeks ago? So we're completed on the lower jaw. He has his fixed bridge, perfect porcelain. Now on the upper jaw, we've been on a temporary bridge fix on the implants for the last 2 months, and this is to shape the gum. So today the gum has been healed for about 2 weeks, so we're going to remove the temporary bridge, take the impression for the final bridge, and he's going to go back for 2 weeks with his temporary bridge. But in 2 weeks we're done. That'll be the end. So you're fine with the lower so far?
Yeah.
Okay. Excited to get the upper one?
Yes.
Okay, so let's do that today, and next week, in 2 weeks, we get the final result. Okay? Welcome back, everybody. So today is very exciting for me and Brett because it's the end of 8 months of work for me to try to rehabilitate Brett's mouth, and for him it's years of waiting to finally get something fixed in his mouth that he can enjoy and chew properly and smile and have a nice life. So if you remember 2 weeks ago we did the impression for the implants to send to the lab, and we received the case, and today we're going to remove the temporary and install the gold abutment that the lab sent us with the porcelain bridge, on which we did a pink porcelain to make it more natural. So we're going to remove the temporary, we're going to try it, we're going to make some adjustment, make sure that Brett is happy with the result, because it's going to be there for the rest of his life. So this is very exciting, so let's do it and see how Brett likes it after. Brett's case was finally completed in early February 2017, only 9 months after taking charge of his case, instead of 12 months we had planned at the beginning. This was all because Brett was able to recuperate faster between each surgery, so we were able to proceed in a shorter period of time. So in 9 months, we went from this on the left side of the screen to this on the right side of the screen. Brett's dental work is now over, although there are still other areas to work on for full recovery. His teeth are good and as natural as they can be. I'm very happy that Brett was placed in my path, but I feel a little sad knowing that he could have been done 4 years earlier. But at least it's done now, and if he takes good care of his teeth, he will be able to enjoy it for a long time. For me, I'm happy that I mastered the surgical part as well as the prosthetic aspect of implant dentistry, so I was able to do the right thing quickly for Brett.
From start to finish, all of the procedures took just under a year. Initially we were planning on a little shorter than that, but Dr. LeMay did a few extra procedures to make sure that I had a better outcome with everything. Dr. LeMay took his time with every procedure that we did. We had to source some of the different implants that he was used to using, but everything came out beautifully, and he took care of them right away, got me in, and it made me feel really confident in the care that I was getting from him. I feel very incredibly lucky that I was able to find Dr. LeMay and that he was able to do all the work that he did for me. I'm really impressed at what an amazing person he is. He truly cares about his work, something that different doctors I've had in the past with my reconstruction could take it or leave it, and he really was proactive to make sure I was okay, checking in on me if I needed pain medication or anti-inflammatories. And if I was worried about something, he would get me in to make sure that you know, if I had sutures that needed to be redone or anything to that effect, he took care of it all, and I really felt like he cared about making sure that I was able to be a whole person again.
You're watching Desert Dental Alternatives Case Files with Dr. Bruno LeMay.
We can't save the tooth. Here's a referral for the root canal, one for the extraction, one for the implant specialist, then you can come back here for the crown.
But can't you do that here? What about my insurance?
I'm sorry, you'll have to ask them about cost and insurance.
Don't get the runaround. At Desert Dental Alternatives, Dr. LeMay is trained in all areas of dentistry, all in his office. You'll know your options and get a clear estimate of your costs. One doctor responsible for all your care. Look for the big tooth on Ramon.
Introducing Chow Pinhole Gum Rejuvenation's Pinhole Surgical Technique. Before, conventional gum grafting required cutting tissue from the roof of the mouth. The gum is then cut over the area of the recession and lifted. The tissue from the palate is placed over the recessions. Once complete, sutures hold the graft in place during healing. Now, with the new revolutionary Chow Pinhole Gum Rejuvenation, gum recession is corrected without cutting or stitches. This new process begins with a tiny entry point that is made in the gum. Then, a special dental instrument is placed through the pinhole to free the gums with gentle movements. Once free, the gums are guided down into a healthy position. When the recessed gums are corrected, tiny collagen strips are placed inside to help stabilize the gums. Incredibly, the pinhole heals rather quickly and often overnight. When complete, the receding gums are corrected with a minimally invasive treatment that is quick, easy, and instantly pleasing.
And now, back to our program.
My second case of rehabilitation I have for you today is a case of severe malpractice where the patient invested time, trust, and a lot of money and ended up with absolutely nothing good. Let me introduce you to Miss Faye McKay. When I saw Faye for the first time, I asked her how I could help her. And she told me that she had paid already over $70,000 for 9 implants, and it's been years, and she still didn't have any teeth on it, and she didn't feel her dentist knew what he was doing.
I went in and each time she said, oh, it's going to be a lot. The girl that was doing the billing was a truck driver, was a retired truck driver. She'd never had any experience. So I said, okay, I'll put $5,000 down. It was like every time I went, I paid $5,000 or $10,000, and they never sent me any kind of a statement. I was naive. It was a lot of it. I was naive. I should have just said no right at the beginning.
I thought to myself, oh my God, they must be in gold, because that was way too much money for just implants.
And the insurance company was paying them, but they never deducted that. They kept the insurance money plus my money, and this is why he's no longer working. The district attorney of San Diego got after him, they sued him. He's lucky he's not in jail.
So I performed as usual a full exam, and I was sad and disappointed to see what I saw.
And when Dr. LeMay took the x-rays, he said, oh my God, they were growing into each other. The implants were going, the bones. Everything that the other dentist had done was completely wrong. All had to be taken out, and I had to go through the whole procedure again.
But I now understood why the dentist was not able to complete the restoration of the implants, because they were not restorable. So let's look at her x-ray and I'll show you what went wrong. At first I thought she had gone to Mexico, because this is in general what I would expect to see coming from there. But no, it was a local dentist. At first, except for the upper right side, where the implants are crooked and touch each other, it does not look too bad. But with a 3-dimension x-ray, it's a totally different story. When you look carefully at the upper right side, there's no way those implants can be restored. In order to be healthy, we need in general 3 millimeters between each implant, and the threads have to be covered with bone, and they need to be parallel, so in this case, the 2 implants had to be removed. Bone grafted and new implant placed correctly further back with bone graft in the sinus slit. Now let's look at the lower left side. On that side, the first implant is totally outside of the ridge, and the back implant is sitting on a remnant of a root which was not removed prior to placing the implant and will cause problems in the future. So they had to be removed and bone grafted again prior to replacing new implants. On the lower right side again, the first implant is not placed properly on the top of the ridge, and the back implant has major bone loss around it. So again, both had to be removed, bone grafted and replaced. Even worse, with this case, we can see with the 3-dimension CT scan that the back implant was placed perforating the lingual wall, which is why it's essential for anybody who needs implant to be placed to make sure that there is a CT scan on premise and that the dentist use it and can read it. After seeing all that with the CT scan, I had to sit with Ms. McKay and tell her the bad news that almost all her implants that the previous doctor had installed had to be removed, and that she would need sinus bone grafting for her upper right side, and that the upper left implant were placed straight but into the sinus without bone grafting. I told her that there was no need to remove them as long as she did not have any infection, and that we will need to follow up on that regularly.
I didn't know what a sinus lift was, but Dr. LeMay told me you never got one. And here I thought, okay, I'm getting a sinus lift and I paid for it. And Dr. LeMay said, no, you never got one. So we had to go through that process.
And to add to the numerous problem, she was losing her upper front left incisor due to severe bone loss and would need an implant there as well, even though she just had a crown done a couple of months before. The tooth was very mobile and the space was starting to show between her front teeth, which is a sign of periodontal disease. What was the worst of all was that she had paid a huge sum of money to rehabilitate her mouth and she still had nothing to show for it. And now it would cost a lot of more money and time to remove the improper placed implant, bone graft, and redo the correction and wait for the healing and the final restoration.
On the next episode of Case Files with Dr. Bruno LeMay.
As a realtor, my face is the first thing that people see it. The looks and the appearance plays a big role.
He's a very good-looking guy in his early 50s. Took care of his health and his body all his life. But as a lot of people do, he let his teeth go. People are affected by the look of their teeth, and their persona changes when they start liking their smile.
And now, back to our program.
At this point, Mrs. McKay wanted to be done and able to chew and was tired of waiting, so she decided to trust my judgment and she gave me the green light to start immediately. The plan was as follows: removal of the upper right implants with bone grafting, sinus elevation, and placement of 2 new implants with a cantilever bridge. Removal of all lower implants and replacement with well-angled ones, and bone and skin graft with final porcelain crowns. Restoration of the 3 existing upper left implants with porcelain crown, and evaluation of the sinus regularly for any sign of infection due to the position of the implant in the sinus. All this would, believe it or not, take over 2 years to be completed.
When I went to Dr. LeMay, everything was spelled out for me, what he was going to do. And actually whenever I went for an appointment, he would explain the procedure he was going to do on that day. And afterwards, I would know exactly what I was paying for.
As it was completed, we could appreciate the quality of the work, parallelism of the implant, and sinus lift on the upper right sextant. She can now smile with all her teeth. The front teeth are no longer mobile with a space, and she finally has back teeth on which she can chew. Her implants are nice and parallel and perfectly well integrated. What a big difference from 2 years before. With the way the implants were placed before, there was no way anybody could have restored them. Mrs. McKay was an amazing patient. She followed the schedule, tolerated each surgery very well, and was very cooperative.
And he was very careful not to have me come in too much at a time, because he knew the stress and the pain that I was going to. He really did.
I'm happy I had the knowledge and experience to take her botched case, because we have to call it that way. That was a botched case.
It's extremely important to get a second opinion. I do it with my medical, always. Anything to do with my medical. I was just naive enough not to do it with my dental work. And a second opinion would have probably saved me around $50,000 and an awful lot of pain, awful lot of pain. And he has no business. This other dentist, he has no business. Well, they pulled his license.
My mother used to say, if you have lemon, turn it into lemonade. Well, I think in her case it took so much time that the lemonade fermented and turned into wine. Now I see Faye every 3 months for cleaning and follow-up, and I'm always proud to look at her and see her smile much better because of me. But all joking aside, because of cases like the 2 that I just showed you today, this is why I can tell you that I love my profession.
He calls to make sure if I've had something very seriously done, he'll call that evening and see that I'm all right. And Dr. LeMay takes responsibility and does what he has to do as a dentist. He does a professional job. And he's very proud of it. He really is. He's really proud of his work. He's a perfectionist. Actually, he's an artist.
Now, after 26 years of experience, practice, learning, and discovery, I feel that I have the understanding and mastery of different aspects of dentistry, like implant surgery and implant restoration, more than most dentists, and I can give my patient an all-inclusive treatment plan. And as I am a person who does not take no for an answer, I don't give up until I succeed. And I always like a good challenge, so if you have one for me, bring it on. Thanks for watching these 2 Extreme Dental makeovers. I hope you were entertained and that you learned something. If you only learn one thing, it's that in any dental situation for whatever procedure, implant dentistry, cosmetic dentistry, orthodontics, or a mix of all, you should always do your homework and research who you will choose to do the work, and always have more than one consultation and estimate. Not only should you research the costs, but also for what options are available to you. For example, one dentist may not like to do root canals and may try to suggest you get implants, but you should be made aware of all your options. And don't forget, when you start a makeover with a dentist, it can be a long treatment plan. And if you don't have excellent communication with your dentist, you may find the treatment very tedious. Also, you should be aware of what I call the red flags. For example, if you are promised a free consultation and end up paying hundreds of dollars for X-ray on your first visit, then it was not a free consultation. This is a red flag. If you're offered only one option and no alternatives, that should make you suspicious too. Also, if you have to see several professionals to get your implants done, for example, this should be cause for concern, because who will be the responsible doctor if there's a problem in the future? If you cannot get a clear and concise treatment plan with the prices clearly stated and an option to split up payments over the duration of the treatment, this is another red flag. You can also consult the Dental Board of California to see if the dentist has had any malpractice lawsuit or complaint. I know I would. Finally, follow your instinct and make sure all your questions are answered before starting anything. If you follow these advice, it should ensure you that you receive a dental makeover that you are thrilled with.